Hello everyone, today in this video we will be dealing about the anatomy of the tympanic membrane. The tympanic membrane is nothing but an oval, semi-transparent structure situated between the external auditory meatus and the tympanic cavity of the middle ear. Suppose this is the ear pinna and this is the external auditory meatus. This is the middle ear and we have the inner ear here. So the junction connecting between the middle ear and the external auditory meatus, so that is this junction is marked by an oval semi-transparent membrane called tympanic membrane. The tympanic membrane consists of three layers, which is nothing but cuticular layer, fibrous layer and mucous layer. The cuticular layer consists of skin lining of the external auditory meatus. The fibrous layer is nothing but a layer between the ring of the fibrous cartilage attached to tympanic sulcus and the handle of the malleus. The mucous layer consists of mucous lining of the middle ear. So this is the tympanic membrane we will be able to appreciate while using a otoscope to examine the ear. So these are the parts of the tympanic membrane. The majority of the part of the tympanic membrane consists of pars tensa. Small portion is occupied by pars flaccida. Here we will be able to appreciate handle of the malleus, umbo, and finally this is the cone of light. The tympanic membrane consists of two parts, which is the pars tensa and the pars flaccida. The pars tensa is the major part, as we have already discussed. The pars flaccida is the minor part. The pars tensa thickens at the outer membrane margin to form a fibrocartilaginous ring called the tympanic ring, which is otherwise called as the annulus tympanicus. The pars flaccida is also known as Sharpnell's membrane. It is a small triangular portion superior to lateral process of the malleus, that is between the anterior and the posterior malleolar fold. When we talk about the surface, the tympanic membrane has got two surfaces. It is nothing but lateral and medial surface. The lateral surface is nothing but what we see externally. It is concave towards the external auditory meatus and directed anteriorly and infralaterally. The medial surface is also known as the inner surface. It is convex towards the tympanic cavity, external auditory meatus, and this is the middle ear and external auditory meatus. So the tympanic membrane will be something like this. The point of maximum convexity is called umbo, which is represented by a dot-like structure over the tympanic membrane. It is created by the attachment of the malleolus to the center of the membrane. Coming to the blood supply of the membrane is divided into outer part and the inner part. The outer part is supplied by the deep auricular artery, which is nothing but a branch of first part of maxillary artery. The inner part is supplied by two arteries, anterior tympanic artery and posterior tympanic artery. Anterior tympanic artery comes from the first part of the maxillary artery, and posterior tympanic artery comes from the branch of stylomastoid artery, which is arising on the posterior auricular artery. When we talk about the venous drainage of the outer part, it is drained by the external jugular vein, and the inner part of the tympanic membrane drains into transverse sinus and into the pterygoid venous sinus. Coming to the nerve supply of the membrane is divided into lateral surface and a medial surface, in which the lateral surface is again divided into anterior half and a posterior half. The anterior half is supplied by the auriculotemporal nerve, and the posterior half is supplied by auricular branches of the vagus nerve. This is one of the major reasons why the patient will be having bradycardia when we stimulate the tympanic membrane. And the medial surface is supplied by the tympanic branch of glossopharyngeal nerve. Coming to the another aspect of the tympanic membrane, we are dividing into four quadrants, which is nothing but this is the posterior superior quadrant, this is the anterior superior quadrant, this is the posterior inferior quadrant, this is the anterior inferior quadrant. This is the handle of the malleolus. It is between the first, the posterior superior and the anterior superior quadrant. The anterior inferior part consists of a triangular area called the cone of light, which will be seen while using an otoscope to examine the ear. This is the long process of the incus. This is the anterior malleolar fold and this is the posterior malleolar fold. And this is the pars tensa and this is the pars flaccida. This is what we see on the medial surface of the tympanic membrane. We will be able to appreciate the chorda tympanic nerve, which is nothing but a branch of the facial nerve arising at the medial surface of the tympanic membrane. And this is the incus, this is the head of the malleolus, this is the hand of the malleolus, and this is the humbo. This is the image we will be able to appreciate when we are using an otoscope to examine the ear. We will be able to see the malleolus, humbo, incus, chorda tympani will be flowing like this, and we can see somewhat here the cone of light. When we come into the clinical conditions of the tympanic membrane, we may able to see perforations due to trauma or maybe due to middle ear infections. Coming to the development of the tympanic membrane, it is nothing but from the first pharyngeal arch. We have told that the tympanic membrane consists of 3 layers, of which the outermost layer called the cuticular layer will be developed from the ectoderm, and the intermediate layer, which is nothing but the fibrous layer, will be developed from the mesoderm, and the innermost layer called the mucous layer, which will be developed from the endoderm. So that's all about the anatomy of the tympanic membrane. Thank you and have a nice day.